Right after delivery, as long as mom and baby are both stable, skin to skin needs to be initiated.
Offering skin to skin immediately after birth will provide your baby that reassurance that mom is here and everything is okay.
Taking the shirt off the baby and placing the baby on the mother, and you just let the baby lay there for a couple minutes and it just regulates their body, and then you can start to initiate breastfeeding.
We want the babies to breastfeed in the first hour, and anytime they're showing hunger cues, that's going to help bring mom's milk supply in and help baby and mom to be more successful breastfeeding.
So important to initiate breastfeeding early to get baby started and for baby to get those antibodies that are there.
Colostrum is the first milk that moms will get. It's about a teaspoon.
It's kind of thick like honey, and it's harder to get out with a pump. It's much easier to obtain when baby breastfeeds.
Colostrum is the first milk loaded with immune properties.
High nutrition, high antibody.
All the immunities that mom has passes through this colostrum. Baby drinks the colostrum, it goes down into the baby's stomach, and it protects the baby's stomach against all kinds of bacteria, viruses, things like that. So it's like their first vaccination.
Throughout the days, she'll have transitional milk, so it doesn't all of a sudden go from colostrum to mature milk. We have a few days in between.
This is what colostrum looks like. It wouldn't be in this much volume, and we don't see it because it goes right into baby's mouth.
And mom, by day 3 to day 5, should start getting her mature milk. When we're breastfeeding our babies, it's important to remember that we want them to have a nice big open mouth before getting them to the breast. A lot of times we're so desperate to latch our babies that sometimes the baby's just doing and we kind of just put them on the breast.
We want to see Goldie the goldfish lips. The lip will flange up and down, or some people will say duck lips, taking as much of the nipple and the areola into their mouth as possible to feed. It may hurt initially when baby latches on or starts to suck, but it will ease up over time. If we hear clicking noises or smacking noises, we usually say, let's break the seal and start over and try again.
We gotta really be patient and wait for baby to open up his or her mouth really nice and wide, and then get your baby to latch. If you get your baby to latch too soon, oftentimes it can lead to nipple trauma or nipple pain, or not a deep enough latch.
Effective latch, you look at the baby's lips. You do what? Fish lips, and you don't want to hear a clicking sound. It's so important to get an effective latch because an ineffective latch can lead to sore nipples, cracked nipples. It can be very discouraging to mom, and it can cause her to decide to bottle feed.
We talk about early hunger cues here at University of Maryland. Babies do the same thing over and over every day. They're rooting. They kind of look like a baby bird looking for the nipple.
You can look at a baby in a bassinet and sometimes they're rooting around or searching for the breast or sucking on their fingers, and those are usually good indications that baby is ready to feed.
They stick their tongue out, they lick their lips, they suck on their bottom lip.
Usually baby opens mouth, they're trying to put their hand in their mouth, they're trying to put anything around them in their mouth.
These are early hunger cues. When we see these things, we're supposed to stop and feed the baby. The baby is still in a calm state. It's easy to get the baby latched on to the breast. A lot of parents come in and they think the way you know that a baby is hungry is that they cry.
Crying is a late feeding cue. So once your baby is crying, that means he was hungry for a pretty long time.
Once they're crying, you have to calm them down, just like an adult. They're upset and they can't focus on what they need to do. You have to calm them down and then try to feed them.
It's important to keep an eye on baby and watch your baby, and so he can let you know when he's hungry.
Nighttime should be the only time that baby wakes you by crying.
We get that how much the baby needs to eat question a lot because we all want to measure amount of breast milk and food, and we were kind of like grown up with this, that's too much fries, this is too much chicken, you need to put less on your plate or more on your plate. Breastfeeding, we can't measure. Breastfeeding babies are just gonna latch to the breast and are gonna start getting the milk out, and you're just gonna have to, I tell the parents, believe that the milk is there and that the baby's getting it.
This is the size of a newborn baby's tummy. So when we think about it, a baby really doesn't require that much colostrum in the first few days of baby's life.
We don't measure amount of breast milk, we measure how many times the baby has wet diapers and poopy diapers, and we also measure the baby's weight.
You know your baby's getting enough food when you're checking the diapers. Baby should have enough wet diapers, maybe 3 to 4 wet diapers in a day. And also if your baby's pooping. If your baby is pooping and peeing, you're feeding the baby enough. Usually recommend that feedings occur for 15 to 20 minutes on each breast. Usually you know that your baby has received enough if baby let go and will stop sucking, or they usually fall asleep.
Cluster feeding is a normal newborn behavior. It helps mom's milk come in sooner, so the more you put baby to the breast and the more you ask your body to make milk, the more milk your body will produce. So cluster feeding just keeps telling your body, I need you to make me milk, so the more you ask your body, the more milk that mom will make.
This is a phenomenon that we usually see the second night after birth, and it's very tiring, and it also is unnerving for moms because they think they're not producing enough milk. But all these quick, frequent feeds helps to make mom's milk supply develop and to ramp up, and will help her to have a really good supply.
A baby may want to feed every hour for a few hours or even for 12 hours. And mom should know that that's okay. That it doesn't mean that mom doesn't have enough or mom is starving her baby. It just means that baby is hungry and baby needs to feed a little bit more often to grow. Exclusively breastfeeding means that mom is only giving baby breast milk for the first 6 months of baby's life. So no water, no juice, no rice cereal, just breast milk. By doing so, mom is able to provide everything that the baby needs, and there's no reason for mom to supplement with formula or anything like that unless medically indicated.
To exclusively breastfeed means to only breastfeed. So you're only attaching the baby to your breast each and every time, each and every feed, and that would be on demand. So any cues the baby gives, you would actually immediately place the baby to the breast.
When the pediatrician says that it's okay to start foods, you follow the directions that the pediatrician are laying out for you. He or she will tell you how often they can feed those foods, but the baby will still get most of their nutrition from the exclusive breastfeeding.
If you take a look at the mother's anatomy and then you take a look at the nipple on a pacifier or a bottle, they clearly do not look the same. So our babies are learning a lot when they come out. They have to learn how to suck, swallow, and breathe. So once we introduce another kind of nipple, we're just confusing them. So by offering just mother's nipple, we usually kind of make things a little bit easier for them and helps them figure out breastfeeding a little bit sooner.
They may get used to mom's contour, mom's nipple, and then they're introduced to this harder supplement, and they may get confused. We have seen infants who have started off with mom's nice, natural, soft nipple, and then get used to a pacifier, and when go back to mommy's nipple, start to cry and get confused.
There's no need for a pacifier if you're looking at your baby's hunger cues. That's what the baby's trying to tell you. Pacifiers are not needed to soothe your baby either. Babies do great, just put baby to the breast.
Breastfeeding is solely mom's responsibility, but family members can help out in so many ways.
They can help by doing all the other things that is not the actual breast milk production. So picking the baby up from the crib can be a simple task, but it might be difficult for the mom who's coming from a C-section or a difficult vaginal delivery.
Changing the baby's diapers helping to position pillows so that mom can get into the right position to breastfeed and where baby's comfortable.
Getting mom some water, some snacks. They can help if the mom is breastfeeding and pumping, they can help clean the pumping equipment afterwards.
Those are all things that dad or grandma could do.
Dad can also do skin to skin, which helps mom, while mom's resting, it can help dad just get involved with the baby.
Dad, the mom's partner, significant other, support system, grandma, grandpa, auntie, godmother can all help mom breastfeeding.
Breastfeeding is hard work at first, but once you get things going, it's a wonderful thing for both you and for the baby. You don't have to mix formula, you don't have to warm it up, you don't have to sterilize bottles. It's right there when you need it. You don't have to go home to get formula if your baby is hungry when you're out shopping. It's just the perfect food for human babies.